Good morning, and thank you very much, Dr. Minter-Jordan, for that introduction. Thank you for all that you and the wonderful folks here at DMIC do in so many ways, but particularly on this issue of addiction and treatment and recovery. I am delighted to be here this morning. I'm also so pleased to be joined by our Department of Public Health Commissioner, Monica Burrell, who you'll hear from in just a little bit. Very pleased to be joined by two people who know the experience of addiction and substance use firsthand, and they're going to tell their stories, Rob Dimeo and Natasha Harkins-Dubey. I also want to acknowledge and thank my great team in the Attorney General's office, Kevin Reddy, Stephanie Collimore, and Chris Caccini of our Medicaid Fraud Division, as well as Colleen Nevin of our Consumer Protection Division and Jim O'Hara from our Investigations Division. I also want to thank Catherine Madden, who from my office has been point on many of the opioid-related issues. Delighted, of course, to see in the audience two terrific legislative leaders who really have taken on the issue of substance use and treatment in a real meaningful way. Senator John Keenan and Representative Liz Malia, thank you for being here today. The dedicated team here at the DMIC Center knows all too well the toll that heroin, fentanyl, prescription pills, and opioids is taking and has taken on individuals, families, and communities across this state. They work every day to provide an array of treatment services to those seeking help and to those working through recovery. But the team here knows all too well they can't fight this epidemic alone. The fight requires an all-hands-on-deck approach. We need more education for young people, more treatment, more access to recovery services, better efforts around prevention and intervention. We're working hard in our office to deal with some of the back-end problems, as I describe it. Drug trafficking. We've got a number of drugs out there on our streets, in our communities. Heroin, fentanyl, and still prescription painkillers and opioids. These are in our communities, wreaking havoc with our communities, causing overdoses, causing death. We've had multiple investigations and brought numerous charges, and will continue to pursue individuals who traffic in the illegal sale of drugs in our state. Just last week alone, we announced charges against 9 gang members who were trafficking drugs in East Boston, Chelsea, Revere, and Jamaica Plain, including heroin and fentanyl. But as we seek to get these drugs off our streets and out of our communities, we also have to deal with what I call the front-end spigot aspect of this problem. And here I'm talking about the doctors, the dentists, the providers who are continuing to prescribe pills in a reckless and illegal manner, endangering the public. Now, over the past year, my office has cracked down on illegal prescribing practices. By using data that we're able to review that details prescribing amounts and by whom, we were able to bring charges against doctors in Ludlow and Hyannis who were illegally prescribing to patients for no legitimate medical purpose. In fact, some of them had documented serious histories of substance abuse, substance use issues. That's important work, and we'll continue to take action against those who would illegally prescribe in reckless or dangerous amounts to individuals to whom they know they should not be prescribing. But in addition to this kind of work, my office is working directly with the medical community in partnership at the state and national level to change the culture around the prescribing of opioids. Earlier this year, we reached out to the Massachusetts Medical Society in a partnership to support training and education for doctors and physicians' assistants. At the national level, my office led a group of attorneys general to support the Centers for Disease Control and Prevention's efforts to draft guidelines that will provide much needed information to primary care providers across the country about when and how opioids should be prescribed for pain, creating a single nationwide evidence-based standard. The proposed guidelines make clear that addictive opioids should not be the initial treatment for chronic pain and should only be used where their benefit outweighs the risks. Now, changing prescribing practices and having the right kinds of guidelines and training in place are a key part of the front end of this issue. that's a gatekeeping function, and we've been really pleased to work with the provider community this year to make changes and improvements, and that partnership will continue. But today is about another aspect. There's the prescribing aspect, and there's the dispensing aspect. Because if the bad stuff's not getting prescribed and not being given out, then people are going to be better off. That's what today is about. Today is about our partnership and commitment with pharmacies to step up to the plate. Why? Well, pharmacies are on the front lines of this epidemic. They are the gatekeepers for powerful prescription drugs, powerful prescription opioids that have helped fuel this current crisis. Why do I say that? Well, we know here in Massachusetts that 4 out of 5 of our heroin users today started with prescription pills. It's as simple as that. They started with pills and soon found themselves using heroin and fentanyl. Last year alone, over 1,500 people died in this state, and we know the numbers continue to be distressing. That's why we need pharmacists as critical gatekeepers on the front end to be part of this solution. Today, I'm pleased to announce that my office has reached an agreement with CVS Pharmacy, the state's largest pharmacy, that will meaningfully impact the company's opioid dispensing practices here in Massachusetts. This is the first of its kind agreement in the country. And that's a meaningful step for people like Rob and Natasha, who know all too well the dangers and despairs caused by these prescription pills. And it's meaningful today for every family in Massachusetts who doesn't want to see their child or their loved one go through this. So let me tell you what we've done. Mass Health has a controlled substance management program. Under this program, Mass Health monitors prescribing and dispensing practices. And there are certain red flags that will go up if a person is receiving a high number of prescription drugs. That person is identified through Mass Health and may be placed in what is called a lock-in program. What a lock-in program means is that a person who is receiving a prescription is only allowed to pick up that prescription at a single designated pharmacy. They can only go to that pharmacy to fill their prescriptions. Members enrolled in the program are assigned to this primary pharmacy, and the obligation of the pharmacy is to monitor the prescription use, or what we call utilization patterns of that member, and to use sound professional judgment when dispensing all drugs. Here's what our investigation into CVS Pharmacy revealed. Our investigation revealed that there were Mass Health members who were in fact listed on a lock-in list who went to CVS to fill a prescription. When the CVS pharmacist submitted the Mass Health claim in real time with the customer right there with the prescription in hand, there were instances where the CVS pharmacist actually got back a message on the database saying, "Don't fill." Nevertheless, the pharmacist went ahead and filled the prescription, not submitting a Mass Health claim, but instead taking a cash payment for that prescription. That's not how the program's supposed to work. Now, we've seen instances, for example, you might ask, why was there a denial? Well, if an individual was attempting to fill earlier than they were supposed to a prescription, there would be a denial of that claim. But again, we saw instances where even with that denial, the pharmacist went ahead and nevertheless filled that prescription. This is a problem. Our investigation also found that until March of 2013, CVS didn't provide adequate enough internet coverage to allow pharmacists to check the prescription monitoring program using the internet. Now, you'll hear later that the PMP, the prescription monitoring program, is really a key component and part of a larger effort to address the opioid epidemic in Massachusetts. It's an important tool for prescribers and for dispensers. The PMP provides a history of what drugs have been prescribed to a patient, and it is very helpful in monitoring prescribing practices and utilization practices. For example, if a pharmacist had checked the PMP during this time, they might have been able to see if the customer had been to a different pharmacy the day before to pick up a similar prescription. We know from our investigations that prescription drug users may move from pharmacy to pharmacy, one day to the next, sometimes several times within the course of a day, trying to fill multiple prescriptions. Now, once filled, they may use these drugs for themselves, for their own use, or we see them end up on the street, sold on the black market, diverted. This is a problem, and again, something that has helped fuel the opioid crisis and the number of overdoses and deaths across our state. But as a result of our investigation and today's announcement, CVS will now require its pharmacists to check the PMP when they fill prescriptions for certain opioids. This is important. All pharmacists at CVS are now, for the first time, going to be required to check the PMP before they go ahead and fill a prescription for certain opioids. These opioids are among the most commonly misused and abused prescription drugs that we have seen through our investigations and our cases. These are the ones that we see diverted and sold on the streets. These are the ones that we see leading to and contributing to heroin and fentanyl use and overdoses and deaths. This is the first time in the nation that a pharmacy has instituted a specific requirement to require their pharmacists to check the PMP. CVS pharmacists must now consult the PMP and review a patient's prescription history, as I said, before dispensing certain opioids. And these are for all customers, not just MassHealth customers, but any customer who is showing up at the counter with an opioid prescription to fill. This was never required before, and I think it is a big deal. It's going to make a difference here in the state. We believe that CVS pharmacists, armed with this kind of information, can help us stop the prescription drug abuse and prescription opioids from getting into the hands of people struggling with addiction or from getting into the hands of people who would look to prey upon others who are vulnerable by selling and then marketing these drugs on the street. In addition to instituting this practice at CVS, at all CVS pharmacies across the state. And by the way, I will mention there are 350 CVS pharmacies here in Massachusetts and over 1,200 CVS pharmacists who will be covered by this agreement. So I think we're pleased because we see that this will have a widespread effect and impact across the state. In addition to changing those practices, CVS is also going to update its written policies and procedures this month to include specific language and guidance around the MassHealth lock-in program and require this as training for all of its pharmacists. In addition, CVS will make a $500,000 payment that will allow us to fund programming to address substance use. The company will also pay the Commonwealth a penalty of $295,000. We're pleased with this result. It's in the right direction as we combat this crisis and continue to work on this issue. We need to deal with the back end and deal with the cracking down and getting after the trafficking of illegal drugs on our streets. We need to continue to support efforts around education and prevention and intervention. We need to continue to support changing the culture around the ease with which opioids have been prescribed. And we also, starting today, are working to change dispensing practices, an important gatekeeping function that will save lives and make a difference, I believe, in reducing the likelihood of overdoses and deaths and addiction here in the state. I want to thank again my team for their tremendous work on this effort, and at this time would like to bring to the podium our Department of Public Health Commissioner, Monica Burrell.
Good morning, everyone. Thank you to Dr. Jordan for hosting this event and for your ongoing work at DMIC to provide holistic care that encapsulates medical care, mental health care, and addiction services. In my past clinical life, I have had patients who have personally benefited from the care that you provide here. So thank you for that. And thank you, Attorney General Healey, for your ongoing partnership and commitment to fight this current opiate epidemic and for inviting me here to be with you today. From day one, it's been a priority of the Baker administration to address the root causes and overwhelming effects of this public health epidemic. Like many places around the country, the numbers in Massachusetts are staggering and continue to grow. They're at an all-time high, and according to our most recent released numbers, over 1,500 individuals died in Massachusetts last year from opioid misuse. That's more than 4 individuals a day, and that is simply unacceptable. We've heard the numbers, and behind each number is a person and their family member and their community. I've seen firsthand from my previous clinical work what this disease can do to our communities. Like many of you, I've worked with individuals suffering from substance use disorder and see the toll it is taking on their lives and their families. And it's for these individuals and for their families that this crisis requires taking action across the spectrum of prevention, intervention, treatment, and recovery. And it means doing so by involving stakeholders from every segment of our society. We must, from healthcare to public health to law enforcement, address this disease in the same way that we offer support, treatment, and recovery for other diseases, other public health issues, other infectious diseases or chronic diseases such as heart disease and diabetes. We've made great progress. To highlight a few key points for you, we've launched prevention campaigns for opiate education. The Department of Public Health is proud to have teamed up with the Attorney General on the Make the Right Call campaign. This highlights the landmark Good Samaritan law and reminds us all to call 911 if we are witnessing an overdose emergency. And in the area of prevention and prescriber education, we continue to work towards enhanced education to balance the need of pain relief with the potential for opiate misuse. As we change the culture and we think about how we prescribe opiates, due to these efforts now in Massachusetts, every medical student, every advanced practice nursing student, every physician assistant student, and every dentist will learn the same core competencies on opiate prescribing across their schools and in health centers across the Commonwealth. And just last week, we launched MassPat, the Massachusetts Prescription Awareness Tool. This is our new online PMP system that is totally redesigned to allow for faster, more user-friendly access to critical prescription information. Over 79% of all Massachusetts prescribers and pharmacists have registered for the system, and it is a vital tool in clinical decision-making that is vital to help us fight this opiate epidemic. Beginning in October, every physician and prescriber will be required to check the PMP before prescribing an opiate to any patient. MassPat is the best tool that prescribers and pharmacists have at their disposal, and ensuring that pharmacists are utilizing the system is a vital step forward. Our work continues with prevention as a key component in our fight against this current opioid epidemic, as well as interventions such as access to Narcan in communities and for our first responders, and increasing access to treatment and recovery beds across the Commonwealth. As we work together across all aspects of our communities, we appreciate the AG's partnership in this issue, and I remind us all that substance use disorder is a medical illness. It's a medical illness, and we must come together to fight the stigma of addiction and provide access to treatment and recovery to all who suffer from this medical disease. Thank you.
Thank you. Thank you very much, Commissioner Burrell, and thank you for the continued partnership on this effort. Dr. Burrell talked about the PMP and the new law that is requiring now providers to register, and that's happening. That is so important. And what we're doing today is covering pharmacists at CVS in the same way. The legislation requires providers, those writing the prescriptions, This agreement, this action by our office is going to require CVS pharmacists to similarly check the PMP for these same opioids. And again, this is about a gatekeeping function and about protecting public health and protecting public safety. Now, if anyone doesn't understand why this is important, we're going to hear from a couple of individuals who know this all too well, who know what it means to doctor shop and to suffer from an opioid addiction. And they're going to tell you firsthand what their experience has been. And hopefully through that, you'll understand why today's announcement is so meaningful and will make a difference. First up, we're going to hear from Rob Demio, who not only will talk about his experience with substance use, but I'm very proud to say and pleased to say that he is working right now with the DMIC, doing great work helping those who are in recovery themselves. Rob.
Thank you. Good morning. I'm Rob, and I'm a grateful recovering addict. Back in 2010, I flipped a truck on 93 north up in Andover, and that car accident, that took my left hand, and I required numerous surgeries. Like that car accident took my hand, but that prescription pill the doctor wrote, that prescription pill took my life. It took on a life of its own. It sent me from doctor to doctor, trying to get another script. It was like my easy pass into active addiction. It went from different pharmacies, paying cash, switching insurances to get my prescription early, and it led me straight to IV use of heroin. My active addiction brought me to the darkest edges of the city. It brought me directly here to the DMIC Center, battered, beaten, and broken. For me, it was the full model of treatment, which when it came time to come off those prescription pills, the doctor just cut me off. The doctor did not explain to me what a detox was, what a taper program was, what a halfway house or a holding was, or what the DMIC Center was, or any other treatment facility. It was just over and done with. I couldn't get another prescription from him. I went through the full model of treatment. I went to the detox, I went to the halfway house, and I went to the sober house. I was hurt, battered, beaten, and broken, but I found my way in recovery. I found a new way of life, and I found other people in recovery working towards the same goals that I went through. And see, like today, this disease of addiction doesn't have a face. Like my mom never associated my face with active addiction, and I went through everything I went through, so like my children don't have to. Like your children don't have to. There are the people behind me working hard for these policies that didn't exist 5 years ago when I was in my active addiction or when I was getting my prescription pills written to me. Today I live a life second to none. Today I attend meetings, I have a fellowship. Today, I've come to this DMIC Center quite a few times in my active addiction. And today, I'm blessed to be able to walk into the same detox that I was on my knees praying for everything I have today and work there as a case manager here. I work with amazing people. DMIC is just doing amazing things. Today, I'm an active board member on a nonprofit organization called the SAFE Project, working to bridge the gaps in treatment. I have people like Keith Laporta, Jen McCary around me that keep me clean on a daily basis. I know today, my day doesn't revolve around a drink or a drug. I know that my day doesn't revolve around a doctor filling my prescription or a pharmacy telling me I'm too early for my next refill. Today I'm blessed and highly favored. Today I have a power greater than myself that keeps me on the right track. And it's all possible because of the DMIC Center. They allowed their doors to open to me for me to save my own life. And it's a powerful thing. And if you know anybody sick and suffering, like I said, these prescription pills now being given to children at an earlier age, it was my easy pass to the active addiction, to the darkest underworld that the city has to deal with when it comes to active addiction. But there's a way out. And I didn't know there was a way out. My doctor didn't tell me there was a way out. My doctor didn't explain much of anything to me. It wasn't until I came around the halls and really was sick and tired of being sick and tired that I found a new way of life and what the solution to this, spiritual problem I have was, and it wasn't a chemical solution. I'm here, I'm alive. I shouldn't be here, and I'm grateful to be here. I'm grateful for my time up here to allow you to tell you my story. Thank you.
Great, and now we're going to hear from Natasha Harkins-Dubey.
Hi everyone, I'm Natasha. So, to give a little bit of background information into the start of my addiction, when I was in high school back in around 2006, 2007, there was a lot of Percocet and Vicodin and Oxycontin going around my high school. And it was a safe drug because it was prescribed. So that was really around the OC boom. Everyone was hooked on opioids. And I thought because I was taking Percocet and someone's doctor wrote it for them that I was safe. I found myself living in a rooming house at 18 years old, fearing for my life. Dropped out of high school, had no family, had nothing, because I thought that I was safe with the opioids that I was taking. I thought it was just something fun to do with my friends on the weekends, and it took hold of me. I got sick of the way I was living, and I decided that I wanted to go back to high school. And I went in and I told my vice principal, and she referred me to a school called Recovery High School in Beverly. When I went to Recovery High School, I really wanted to stay sober. I was all for it. I wanted my life back, and I had my wisdom teeth pulled that year. I went to the dentist, and the dentist insisted that I took the Vicodin. I kept rejecting, saying, I am sober. I cannot put a drug into my system. He's like, take them home with you just in case. So I did, and being early in recovery and an addict, I took that whole prescription in one day, and I was off again. Years later, I found myself pregnant, and I swore that I would never abuse drugs again. And after I had my daughter, I had all these files that I'd been in, all these detoxes, and it was on file that I was an addict, and the doctor prescribed me Percocet after I had my daughter. I ended up back out in the drugs. I ended up losing custody of my daughter, being homeless, and had absolutely nothing. And I'm glad to say that that is no longer the case. I have custody of my daughter. I found a life in recovery. I found a spiritual solution. I no longer need to put a pill into my system because of the network that I found. I will be attending Boston University starting next Tuesday to go for psychology and minor in public health because I want to fight this opioid epidemic that took my life at one point and took my daughter from my arms. I know that if I didn't have the support network that I have, there was no way that I would be here today with over 5 years with no opioid in my system. I am extremely grateful for Moore and Marianne Frangulis because ever since I have become sober, they have kept me in the know on what is going on in this fight. And it has really inspired me to get involved. And I felt like that this is something that I owe to my community because I got to recover from this and my friends are dying. And I want to play a part in helping people get better, helping people find treatment resources, prevention programs, how to live a life in recovery, and how to change the policies that are failing our community right now. And that is why I decided to go back to school to fight for this. And I'm just really grateful that I get to be here today and share a little bit of my story with everyone. Thank you so much.